From VOA, Learning English, this is the Health Report. When people hear a scream, they usually respond quickly. But why are screams so useful in warning us of danger? New research helps to explain why screaming is disturbing and useful. People of all cultures and languages hear the same thing in a scream: fear. David Popple is a neuroscientist at New York University. He wondered why screams are recognized in the same way by people all around the world. He and his colleagues recorded screams from movies and from volunteers. The scientist, however, did not measure the screams only for loudness or sound. Instead, they measured how quickly the sounds in the scream changed in volume. The researchers found that screams are different from other kinds of sounds we hear. Sounds are described in terms of their frequency. Frequency is measured in hertz. Normal speech changes in volume at a low rate, about 4 to 5 hertz or cycles per second. Screams, however, change in volume very quickly and very widely, from 30 hertz up to 150 hertz. When the volume of a sound changes that quickly, it has a quality called roughness. The more roughness a sound has, the more worrying it is. The researchers found that the greater roughness of a sound, the more it activates the amygdala. The amygdala is an area deep in the brain that answers to fear. Screams, it turns out, are a direct link to the part of our brain that tells us if we should be afraid or not. For VOA, Learning English, I'm Jonathan Evans.
From VOA Learning English, this is the Health Report. Ancient people knew that some kinds of clay had healing qualities. They put clay on their skin to cover wounds. They also used the natural rock or soil material to treat stomach problems. Now, American researchers may have discovered how some clays work as a medicine that could fight some infections. Blue clays are found in volcanic areas of the world. Linda Williams is a clay and mineral scientist at Arizona State University in Tempe. She and her research team found the clay was effective against some pathogens. Pathogens are bacteria and viruses that cause disease. In laboratory tests, they saw how a blue-colored clay is effective against MRSA. MRSA is a sometimes deadly bacterial infection that does not respond to antibiotics. The clay was also effective in treating Buruli ulcer, a skin disease found in the Ivory Coast. Here is how the blue clay works against bacteria. The clay contains iron and aluminum, and these minerals work together. Linda Williams says aluminum lets iron flood into the harmful bacteria. The iron oxidizes or mixes with oxygen and then kills the bacteria. Williams says she hopes the study will interest drug companies that want to explore the healing properties of blue clays. The National Science Foundation provided financial support for the study. Williams and her team reported their findings in the journal Nature Scientific Reports. For VOA Learning English, I'm Peter Musto.
From VOA Learning English, this is the Health Report. New research suggests that speaking more than one language may delay different kinds of dementia, the loss of mental ability. In fact, researchers say speaking two languages appears to be more important than education in defending against dementias. A study in India examined the effect of knowing more than one language in delaying the first signs of several disorders. They included Alzheimer's disease, frontotemporal dementia, vascular dementia, Lewy bodies dementia, and mixed dementias. Researchers studied nearly 650 people whose average age was 66. 240 of those studied suffered from Alzheimer's, the most common form of mental decline. 391 of the subjects spoke two or more languages. Investigators found the dementias began about 4.5 years later in those who spoke more than one language. Thomas Bach helped to organize the study. He is with the Centre of Cognitive Aging at the University of Edinburgh in Scotland. He believes the mental effort of seeking words in different languages improves what scientists call executive functioning or attention to tasks. This ability often weakens in people with dementias. Researchers found there was no extra gain in speaking more than two languages. Thomas Bach says it does not appear important whether you learn a language at a young age or later in life. Scientists found that speaking more than one language helped delay dementia, even in those who could not read. A report on bilingualism and dementias was published in the journal Neurology. For VOA Learning English, I'm Laurel Bowman.
From VOA Learning English, this is the Health Report. Ashanti Matai came to the United States from Sri Lanka in the early 1990s. She went to Princeton University in New Jersey and got a degree in chemical engineering. Then she went to Stanford Business School in California. After that, she began her career in the healthcare industry. 4 years ago, Ashanti Matai was visiting Sri Lanka for her job. Someone asked her if she would collect used eyeglasses in the United States for a Sri Lankan program on preventing blindness. She learned that many people in the country have vision problems that go untreated because of the high cost of eye care services. But instead of recycling used glasses, Ms. Matai founded So Others May See, or SOMS. The nonprofit company helps Sri Lankans who need eye care. To date, SOMS has helped about 24,000 adults with eye exams and new eyeglasses. SOMS also partners with Sri Lanka's Ministry of Health to provide free eye care for children. One program goes to schools across Sri Lanka to carry out eye examinations. The service has examined 900,000 students so far. Ashanti Matai says there is still more that needs to be done. She says she wants her SOMS to treat more complex cases and to help prevent vision problems. She says she wants to include people who may not be very poor, but who still cannot pay for glasses. Ms. Matai has used reading glasses from an early age. That poor eyesight has given her clearer insight on a world where everyone can see. For VOA Learning English, I'm Carolyn Presutti.
From VOA Learning English, this is the Health Report. A new study in Korea found that night owls, people who stay up late, face a greater risk of developing diabetes than larks, people who wake up early. Researchers said this was true even when they slept the same number of hours. The study found that people who go to bed well after midnight develop more health problems than people who go to bed early. Orfeo Buxton studies the human brain and nervous system in the Division of Sleep Medicine at Harvard Medical School. Mr. Buxton was not involved in the Korean study, but he says that the relationship between sleep and disease has to do with the human body clock. He says the body prepares for activities linked to time of day. He says humans shut down as night comes on, so eating at that time can have unwanted results, like weight gain around the body's middle. The Korean researchers compared the health habits and metabolism of about 1,600 people, ages 47 to 59. The group was divided by their so-called chronotype, or sleep-wake cycle. The night owls were found to have higher levels of body fat and fats in their blood. They also had more muscle wasting than the larks. Mr. Buxton says people whose jobs start later in the day are more likely to show the signs of increased risk for diabetes. He says the night owls generally had unhealthier lifestyles. This includes smoking, exercising less, and eating later. Mr. Buxton published his study in the Journal of Clinical Endocrinology and metabolism. For VOA Learning English, I'm Alex Villarreal.
From VOA Learning English, this is the Health Report. Many people say they cannot start their day without first having a cup of coffee or tea. People say these drinks help them think clearly and feel awake. This is because of caffeine, a substance found in some plants. Caffeine helps to give a jump start to the nervous system. Now, a report says it may also improve long-term memory. The report was published in the journal Nature Neuroscience. Mike Yasa is with the University of California in Irvine. He and other researchers wanted to know if caffeine could improve what they called memory consolidation. They asked a group of individuals to learn something new. Then, the same people were given caffeine, the active ingredient in coffee, tea, and chocolate. The research team studied 160 people who were caffeine-free. On the first day, these people were shown pictures of everyday objects. They were asked to identify whether the pictures could be found inside the house or outdoors. Some people were then given a pill with caffeine. The others were given a placebo, a pill containing an inactive substance. On the second day, all of the subjects were asked to look at more pictures. Some of the images were exactly like the ones they had seen 24 hours earlier, but other images were different. Individuals taking the caffeine pills had a 10 to 12% increase in their ability to remember objects. The amount of caffeine used in the study was similar to a strong cup of coffee. Mr. Yasa says pills with a little more caffeine also increased memory, but resulted in some people appearing more nervous. For VOA Learning English, I'm Carolyn Presutti.
From VOA Learning English, this is the Health Report. New research in India shows that children eat better when their mothers have more power, more education, and are able to move about freely in their communities. Researchers found that women who joined a job skills training program felt more in control at home and in their families. And the children of these women ate more rice and dairy foods. A program in southern India is called Mahila Samakhya. It brings women together to form local support groups. Researchers at the University of Illinois questioned if and how these groups affected the women's sense of themselves and their positions in the family. Kathy Bayless is an economist at the College of Agricultural, Consumer, and Environmental Sciences at the University of Illinois. She led the study. Ms. Bayless says that before joining the peer groups, the women knew fewer than 5 other women to whom they were not related. Ms. Bayless adds that many of them did not know the possibilities for women in work and in family life. Experts say 40% of Indian children under the age of 5 suffer from underfeeding. But Ms. Bayless says involvement in the support groups led them to provide better foods for their children. Researchers visited the homes of those involved in the groups. They created a simple measuring process. They brought different sized food bowls and asked the mothers which size bowls they were using. Researchers confirmed that the children were eating better based on the size of bowl the mothers used. They found that girls especially started eating more. For VOA Learning English, I'm Laurel Bowman.